Okay, so somebody asked if I would show them how I got underneath the rib cage with a device. Um, so again, I was a massage therapist for 20 years before I moved to California in 2020. So I do have clients from there that still ask questions, and then people that know me know that if you have a question, I'll answer it. With massage stuff, right? Like, doesn't bother me for that, for massage stuff, like stretching and stuff like that. Anyways, so I was doing yoga frequently, and yoga has been extremely helpful after a car accident in 2018. My SC joint subluxes and is hypermobile, which means this ligament or this joint from the sternum is movable, and it is not supposed to be. It is one of those fixed joints that a ligament holds it in place, and once that ligament is outstretched, it will be mobile and movable from then on. However, mine isn't like extremely mobile where I need to worry about not doing yoga at all. Doing like plank pose and different shoulder techniques with yoga has helped to strengthen that joint, so that hopefully that doesn't happen as often. However, about 6 months ago, I didn't stretch. I was on my lunch break, had enough time to eat something, and then I headed outside to do yoga in the shade, and I did a handstand off the wall, and my shoulder popped out, and it was painful, and I popped it back in, and was like, got it. Okay, we are not going to do handstands again, not like that. So from that like thing, I've been doing a whole lot of like massage techniques, stretching, cupping, trying to get this to like chill back out, because it's been like flared up and hurting. So one of the things I was talking about was releasing the fascia from like the diaphragm, and so also in the car accident, not only does this sublux, but I crushed cartilage on the left side of my sternum. So because there's a weakness there, once you have a broken bone or broken cartilage, there's a weakness. As it's healing, fascia can like wind around that injury site, and if there's any scar tissue in there, the fascia on that side or that fascial sheath can get twisted up and tied up, just kind of like your pantyhose can. And like your pantyhose. That's a funny analogy, right? If you're a man, hopefully you have something that feels like that, right? You wake up in the morning and your shirt's all twisted around, right? It gets all twisted up. So one of the things that I can do is a diaphragm release, and I have my thumper thing that a friend gave me at work, which is really cool. It has a heat thing on it. I have it turned up all the way, but so I lay back on my pillow so that like my chest is supported and like up off the bed. That's a really funky look, isn't it? But I am going like up the sternum. You can hook into the pec major. And that feels really good. So that is bottom of the sternum, and then you curve the head of that under your rib cage. I don't know if you can see it, hopefully you can, but that feels really good. So instead of using my hand, I'm using the vibration of this to hook in underneath that rib cage, and I'm just sliding down. So obviously if it's super tight, like you want to be gentle and ease into it. Like don't put immediate pressure, right? Go with what your body allows in this area. Deep exhalation as you're like pressing in harder underneath the rib cage. Maybe find a good spot like right there. So when I say a good spot, I mean like a spot of tension, an adhesion, someplace that needs me to work and focus on. And it can be like pleasure pain. It's called an arc in massage therapy, where you have like a pain point and then it like wraps around to somewhere else, and that's how you know you're on a good trigger point. It feels really good. Because this fascia connects to my pelvis as well, I can pick my leg up and move my leg around, and it will have an impact on that fascia. Anyways, coming up the sternum feels really good for that kind of injury. That's how you hook into. I can get pretty far under there, but it's helpful in like opening up your chest and making sure that you don't have pain or restriction. Anything that restricts your breathing has an impact on your heart, blood flow, circulation, memory fog, things like that. I hope that was helpful. I hope that makes sense. If you have any other questions, feel free to ask.